Knock, knock, knock. Good morning, Mr. Thaler. How are you today?
Good.
Good. How'd you sleep last night?
Great.
Great. Good. My name's Amanda. I'm going to be your nurse today.
Okay.
And I'm coming in to do my morning assessment. So I'm just going to look you over from head to toe and make sure everything looks good this morning.
Okay.
Are you having any pain right now?
No.
No. Have you had any pain since you've been in the hospital?
No.
No? Good. That's good to hear. If you did, I would assess it on a scale of 0 to 10 and ask you where it was located and the intensity. Okay, great. So first I'm going to take your vital signs. This is the blood pressure machine.
Okay.
It goes around your arm. You're going to feel a little squeeze. I'm just going to pretend to do that, okay? Beep. While that's taking your blood pressure and your pulse, I'm going to take your temperature under your tongue. Have you had anything to drink in the past hour?
No.
No? Good. Okay. It goes right under your tongue, and you hold it until the machine beeps, but we're not really going to do it. Okay? Great. So you have a normal temperature, and you have a normal blood pressure and pulse. There you go. So I was wondering too, can you tell me where you are today? Where are we right now? At the hospital.
At the hospital.
Good. And what's the month today? What month is it?
I think it's October.
October?
Nope, not October. August.
August. There we go. Thank you. And do you know who the president is?
President Obama.
Obama. Very good. So that tells me that you're thinking straight and clearly. And I'm looking at your face to make sure your face is symmetrical and you don't have a droopy eye or a droopy cheek. I have my pen light here. I'm going to also dim the lights in the room and look into your eyes and make sure your pupils are regular sized. Okay, so click, we turn the lights off, and I want you to look right at my nose, and I'm going to look in your eye and your other eye. Good. And can you follow my pen with your eyes, keeping your head straight? Follow it. Very nice. And up and down. Very good. And how about, can you stick your tongue out? Ah, very good. Take a little peek in your mouth. Everything looks great. Now, are you having any numbness or tingling anywhere in your body?
When my foot falls asleep, it sometimes tingles.
Yeah,
That's all.
that does happen. But not just right now.
No, not right now.
Oh, good. All right. My next thing is to check your muscles. Can you squeeze my hands tight? Ooh, good. Can you pull me towards you? Ooh, good. And push me away. Very nice. I'm also going to do that with your feet. So can you push down on the gas real hard? Ooh, good. Now pull your toes up and don't let me push them down. Ooh, very good. And then how about, can you lift your knees off the bed? Ooh, very good. That's hard. All right, that's good for that. Oh, while I'm down here, actually, I will feel your pulses. That's feeling your heartbeat in your feet. Okay, and I'll feel these too. And I can also feel behind your knees.
And on my wrist.
Oh, and on your wrists. Wouldn't want to forget those. Fantastic. Now, how about, have you been using the bathroom okay? Like, have you been going pee?
Mhm.
Yeah. And have you had any pain or problems with going pee?
No.
No? Good. How about going poop? When's the last time you went?
Well, I went pee a few minutes ago.
Uh-huh.
And I can't remember the last time I went poop.
Oh, really? Do you feel sick to your stomach at all? Like you might throw up?
Nope.
Do you have any pain in your belly?
No, I don't.
Oh, good. Okay. So, that's good. I'm also looking at your skin to make sure you have no cuts and bruises or boo-boos anywhere. And if I do see any, I'll make a note of them and measure them and write them down in my chart. So the next thing I'm going to do is listen to
I
you.
have one on thumb.
Oh, you do have some. Those are small healing abrasions. Those look pretty good. So the next thing I'm going to do is listen to you, okay? I'm going to listen to your heart and your lungs and your belly. Okay? So for your heart, I'm going to listen in 3 places. These are my favorite places to listen. And I'm listening to see if it's regular. You can just breathe regularly. So I would listen for 30 to 60 seconds, depending if it's irregular or regular. If it's irregular, I'd listen longer. And I could also feel the pulse at the same time to see if the patient's in AFib. Very good. So now we're going to do some breathing. And it would be best if you'd sit up for me. Would you sit up for me? Scoot your buns back up here. Thank you. So we're going to listen to your lungs just for, this is where I would listen, for one full inhale and exhale. Good job. And then I'm going to listen on the back for an inhale and exhale in 4 places or maybe 6, depending on, this is a normal healthy person. You might only do 4 on the front and 4 on the back, but okay. And then we'll make sure we get the right middle lobe. Make sure there's nothing in there. So we're listening to that. Now you can lay right back. I'm going to put your head flat. The proper way to listen to stomach sounds is to listen. You're going to feel a cold stethoscope when they're flat. So you would listen in all 4 quadrants for the presence of bowel sounds. Does that tickle? Very good. And we can also feel, make sure it's not tight in there since he doesn't remember the last time he had a bowel movement. Okay, while you're laying flat, can you roll over to your side? And I'm going to look at the skin on your back and make sure that you don't have a bed sore on your bottom and that you're clean and that the bed doesn't have any hidden objects in it. I think that's it. I think we checked you from head to toe. So do you have any questions for me, Mr. Thaler? No? If you need the nurse, I want you to...
Well, you said something about right here.
Yeah. I just listened, and I heard your belly gurgling, so I know it's not stopped up. So I'm going to put your bed down to a safe level. I'm going to make sure you know if you needed me for something, what would you do? There's a button. There's supposed to be a red button that says nurse on it. So you'd push the button, put your bed down, put your call bell in reach, and say thank you so much for being cooperative. Have a great day. Talk to you soon.
Okay.